Hello. So I apologize in advance for the background noise. I don't know how strongly it's going to come through on the recording, but I am going to do a quick demo with a younger chick on how you would bind together the legs if they had slipped tendon or splayed leg. So first thing you're going to need is self-stick band-aid. I typically cut out a strip about that length to start, and of course the birds are choosing this time to be loud. So I'm gonna cut it, and then after that you're gonna take a strip and you're gonna cut a strip this way. So then you've got this little guy here. Now we're gonna go get the demonstrational baby. So again, this baby does not have splayed leg or slipped tendon. This is just going to be for demonstrational purposes. So you're going to gently take your little baby, and then you need to gently pinch the legs like that. And then typically you're going to grab the one leg and then pinch that together. You do want to have a little bit of length there. Then you're gonna wrap it under the other leg. So you're gonna be like that. And then you are going to take that and you're gonna pinch that over. Now baby's gonna be a little bit dramatic. You're gonna slip it up, pinch it a little. Like I said, make sure you have a good, decent overlap here, just to keep that in position. And then that is how you would have a hobbled baby if it had a splayed leg or a slipped tendon. Now you want that overlay here because if you don't have a proper overlay, it is going to come off. It does take a little practice, but that's the gist of it. And then for splayed leg, you'll typically keep that on for 12 to 24 hours. Slipped tendon, because these are too small to maneuver the joint back into place, you typically have to keep it on for up to a week or more. But it does typically correct if you catch it early enough. Splayed leg is going to be both legs. Slipped tendon typically presents as just one leg that they're out to the side and they can't keep underneath of themselves. Now you do want to make sure that you have overlay, like I said, to keep it on better, but you also need to make sure that you have something that you can kind of grab at to get it undone and or be able to slip it back off, because this stuff does gradually tighten and you'll need to redo it once daily typically. But yeah, leave yourself a little corner, that way you can grab and pull off and not end up with a chick like losing blood flow and then potentially losing a foot or leg. But yeah, like I said, it takes practice, but once you get the hang of it, it's pretty easy. I'll try to remember to do a demo video on a hatchling next time I've got some, but these are a couple days old already. But this is typically the stage where it's gotten to a more severe noticeable point and is about where you would be experiencing the issue of having to bind it in the first place. He's a very good demo baby. Yeah. He's a good little baby. He's pretty chill. That's why I chose him for this. Thank you very much for watching, and I hope that was helpful for anybody who needed it. Bonus little baby video.